What is a handover? Clinical handovers are types of staff communications undertaken by all healthcare professionals at various times during shifts or patient transfer times. Handover times give staff the opportunity to convey important information about patients and to ask their colleagues to continue care during the next shift. What types of handovers are there? You might expect to hear a handover from a colleague in the following circumstances. At shift handover times, to let you know what's been happening with your patient during the previous shift and tell you anything which needs to be done in the following shift. As patients are transferred to another part of the hospital or to a different healthcare environment, for example, from hospital to care home, you would expect to hear a summary of the patient's care and care needs. As patients return from a test, you would only expect to hear about the patient's recent visit and perhaps receive instructions about care needs after the test. Before a colleague takes a break or leaves the ward, your colleague may ask you to keep an eye on their patient or perhaps do something for the patient, for example, take the patient's OBS. What sort of information is handed over in a handover? During a real handover, much of the information can be quite technical, and healthcare professionals often use a lot of abbreviations. During the OET listening task, you hear the type of information you would expect to hear during a handover, but you won't hear complex terms or obscure abbreviations. The information you might hear in a handover includes the following. Changes in patient observations or OBS. A patient's OBS are temperature, pulse, respirations, blood pressure, and oxygen sats. So, for example, her temperature has been quite high this shift. His blood pressure went down to 80/50 this morning. Her sats were down to 89%, so we gave her some oxygen, which brought them back up to 99%. Information about tests or investigations, for example, blood tests, CT scans, X-rays. He had some blood taken to check his iron levels. She had an X-ray this morning to see if her arm was broken. He'll need a repeat CT scan next week after his treatment. Details about new treatments, for example, for an infection or after a new diagnosis. She started some antibiotics 3 times a day for her chest infection. He's going to start blood pressure lowering medication for hypertension. Information about medication, including IV medication and intravenous infusions. He's got IV normal saline running over 8 hours. She needs to take a daily iron tablet until the end of her pregnancy. Changes in wound management, including dressings and bandages. She's having daily dressings to the pressure ulcer. He's got an occlusive dressing over the wound on his lower left leg. She needs to have a compression bandage put on after the ulcer dressing has been done. Notification of adverse incidents, for example, falls or medication errors. There was some water on the floor in her room this morning and she had a fall which caused some bruising to her right arm. He was given the wrong dose of his medication this afternoon. He has been reviewed and no ill effects have been noticed. Changes in a patient's mental state, for example, confusion or aggression. She became quite confused this afternoon, possibly as the result of a urinary tract infection. He became very aggressive when I told him he couldn't leave the ward to have a cigarette. Events about to happen in the oncoming shift, for example, tests or procedures. She has to have an MRI this afternoon and needs to be ready by 3 p.m. He's first on the afternoon list for surgery and should be ready to be collected by 2 p.m.